Good morning, everyone, and welcome to the GP podcast by Nadia. Today is Monday morning, and I start my clinic at 11 a.m. on Monday mornings. And after dropping kids off to school, I usually have these 10 minutes to make a quick video for my passion. So today, what we are going to do is we are going to very briefly touch upon a very important topic and a very common presentation, which is of lethargy, chronic fatigue, and or tiredness. So this is the most common presentation or symptom that I have encountered in my GP practice since I've started working as a GP, which was last year, 2023. Before that, I was working in the hospital for 10 years, but I started work as a GP just last year. So this has been the most common presentation, patients coming in with the primary complaint or primary symptom of lethargy or chronic fatigue or tiredness or feeling weak and no energy. So this is basically a symptom which has myriad of causes. It's usually multifactorial, usually has a disease or many diseases as the cause of this symptom, because it's just a symptom, it's just a manifestation of various causes usually at the end of it. So it is impossible to make a podcast on this like once. It might need 20 podcasts because I have seen so much of this and I have researched so much on this that I have got so much to tell you. But today what we'll be doing very briefly, I would like to just touch upon few of the causes and few of the blood tests that you can request your GP to get them done. Usually, I'm sure that when you go to a GP complaining of chronic fatigue, they would usually do these blood tests. But if they miss on a few, after today, you can ask them that if we can please add these blood tests to this so that we can, because as I said, that fatigue and tiredness has got multiple causes at the base of it. So, but we want to find out all of them so that we can treat them. Okay. So when they do blood tests on a chronic fatigue patient, full blood count is very important. EUC, electrolytes, urea, creatinine, which mainly reflects your kidney function. Then liver function test is very important. Then we have got ESR. ESR is erythrocyte sedimentation rate, which is a marker of chronic inflammation. So any of the chronic inflammatory disease in your body, any of the autoimmune conditions can cause you to be fatigued and then can cause ESR to be high. Then iron studies are very important. Both deficiency of iron and load of iron, which is like when your body is overloaded with iron, which is a condition called hemochromatosis, which is a genetic defect, and it's only present in the families where this disease is present. It goes from generation to generation. So that also can make you fatigued. So the deficiency and the excess of iron both can cause it. Then B12. B12 is one of those vitamins that their deficiency can definitely cause lethargy. Vitamin D. Vitamin D is very important, and again, the deficiency of vitamin D can cause a lot of lethargy. Then also always ask about thyroid function test, because both hyperthyroidism and hypothyroidism can both cause you to be fatigued. Then, I know it's a bit of an ask, but if you can ask your GP to, if you have got joint pains and stuff like that as well, if they can screen you for autoimmune arthritis, all the autoimmune markers and inflammatory arthritis markers, because sometimes these conditions can be underlying as well, and they can also cause chronic fatigue. Then apart from that, sleep apnea is one of the causes. Any allergies, asthma, chronic health conditions like, if one suffers from diabetes mellitus, obesity, high BP, high cholesterol. So all of these can be underlying causes of chronic fatigue or tiredness. So this is just a very small touch up upon this subject, but we will talk about it in other podcasts as well. Thank you so much. Have a great Monday.